So if come to NAC OSCE, you need to have study materials. The first study material you need is Dr. Basil notes. That's the whole textbook that you need to read and go through thoroughly. Then next thing you can use from Edmonton manual, because you have to do some ethics, cases from Edmonton manual. Then there are different NAC OSCE guidebooks that you can use if you want to see something from there. Otherwise, Dr. Basil notes are more than enough if you go through all of them. Let's coming to the topics what you need to cover. Everything that's written here in Dr. Basil notes. There are other topics in regards of ethics that's not mentioned in Dr. Basil notes that you need to do from Edmonton manual. So you need to do those cases as well. So you need to know acute cases, chronic cases. Let's go with the chest pain, in the asthma. You need to know for the acute, if somebody is coming for the first time, if somebody is coming for the second, third, or fifth time, then you need to know how you're going to approach that chronic case and how you're going to deal with that person. Then you need to know that if the person is coming in the family practice, what are you going to do? Especially like in clinic, if the person is coming in emergency practice, what are you going to do? So those things, everything is different. Then along with those, let's suppose if you go with the diabetes, you also need to prepare for the diabetic complications as well. If you go by the counseling, then sometimes the chest pain can come in counseling as well. It's not just the history and physical examination. Sometimes you have to do the counseling as well. Sometimes the post-operative counseling can come as well. Somebody who just had a surgery, after that, how you're going to counsel. So it's very, very, very important. I mean, that's why I said, if you try to prepare by yourself, try to do it from Dr. Basil notes, but you still need some help. So, if somebody who is expert in that, ask them to help you in regards of that. Then along with this is HIV counseling. This is very important. So you have to do all of these cases. That is actually in Dr. Basil notes. Now coming to Dr. Basil notes, there are two type of Dr. Basil notes. One is like this, which will look like this one. So third edition is good. You don't have to worry about the edition types. Third edition is more than enough for you to prepare. Then there is another one. Let me show you the other one. This one. I personally like this one more than that one. Just give me a second. Okay. So I personally like this one more than the other one, because if you go by this one, it has more cases as compared to the other one. So if you click on this one, whichever you click, it will open right away. And then everything is written. Even the DDs are written. In the other one, the differential diagnoses are not written. But in this one, the differential diagnoses are written. But at the same time, it's not enough. Okay, you have to know more differential diagnosis, because once you are taking the history, you are ruling out differential diagnosis. That's why your own notes will help you in this. So try to make your own notes of differential diagnosis, post encounter questions of the physical examination. That will help you a lot. Especially, let's suppose if your exam is in 9 September, it will help you a lot in August to revise every single thing. That's why if you are a beginner and about to start, make your own notes. It's very, very important. If you go by this one, you're going to do OSCE, PQRST. So you have to follow the same route. Your history should not be broken. So your history, when you are asking about the physical symptoms, that is the patient is coming, you are going to continue and complete all of those things. Don't just jump and start asking about OCD and then start from past medical history. Your history should be in a very good flow. It shouldn't be broken. Just same goes for the counseling. That's why you need to know a lot of practice. Okay, so do a lot of practice, with your study partner or whichever person you are doing. Okay, have one or two study partners so everyone can give you a different opinion. Not having one is not enough. Okay, so get two or three study partners. If one is from your course which you are taking and one from somebody else, because let's suppose if somebody is taking somebody's course, right, and you are taking somebody else's course, he or she might know different things than you. So if you communicate or collaborate with that person, that you can have a better vision or better horizon of knowing more things. Okay, so that's about this thing. This is just the basic idea of NAC OSCE that you need to prepare for. And coming to my own course, I am conducting from 29th of the May. The whole point of doing that is I want to do a lot of testing in that. Let's suppose if you did cardiology, I want to do, when you are done with cardiology, let's suppose if we did Monday and Tuesday for cardiology, I want to test your knowledge on Thursday, what you have done in the whole week. Because the whole point of doing the NAC OSCE course or NAC OSCE, you need to have a better idea. Let's suppose if you're doing it with a study partner, you did one case of the chest pain, like pericarditis with one person and chest heart failure in the next person. You covered doing one case every day. You covered cardiac, right? And you started respiratory. If you didn't test your cardiology, eventually when you are done by respirology, you will able to forget your cardiology. That's why when you are done with one system, make sure you are 100% ready for that system. That's the only way you can get like more than above standard deviation. Obviously you can pass it without even practicing a lot. If you go and sit down, it's good to go. Okay. But if you want to score good marks, at least what they are looking for more than that marks, because you are going to apply for specialty or whatever, the CARMS or PRA, whatever, they actually look for these marks. Then on the basis of that, you will be able to proceed further. That's why your whole point, because this is $3,000, you shouldn't be wasting this $3,000. If you are not ready, don't go for it. Okay. Anybody who has a question from this one? In the next class, I'll try to do a presentation where somebody can present with me, or I will try to present. Okay. So you have a better idea how you're going to do. We have some cases like that. Let's suppose if you go with the chest pain, how you're going to approach that person. Starting from that, there is so many red flags that you need to know. Let's suppose if you go by red flags, I'm just giving you an example. If you knock on the door, and like let's suppose if you go and they give you a 35-year-old male is sitting inside having chest pain, take his history and do physical examination. Then on the next 3 minutes, doctor will ask you questions. So you knock on the door, you enter, and without even sitting down, without doing hand sanitizer, you start taking history. It will give you a red flag. So you need to know these things before doing anything further. So make sure you know the red flags before proceeding further. Okay. So that's about it. How many months? It needs at least 3 months. If you can give at least 4 hours per day, then 3 months are good enough. I personally started in June and give in September. So if you give 3 months, it's good enough for you. Okay. If you give 4 hours per day, 4 hours per day, 3 months. Okay. So, and your knowledge should be fresh. Okay. So that's about it. Thank you so much, everyone. I just tried to do a bit of what you need to do and what you don't need to do. And a lot of people have been asking, like, what did I do? I personally did NAC first and then QE1. I was preparing for QE1, and then just randomly I thought of giving NAC first. Somebody just gave me an idea, so I just did the NAC first. So there's no point of I'm not saying that you should be doing NAC first. It's totally up to you. You can go for NAC first or QE1 first. It's just your own idea. I did NAC first, and I started because I was starting QE1 preparation from like couple of months before. So I just don't want to waste my time. So that's why I go for NAC first and then QE1. Okay. I hope that answers a lot of questions that you have been asking me.